I don't know what's going to happen, but I know something spectacular is coming out of all of this. I was in this clinic with my hands on a patient. The patient was looking out the window, and I could see through another window there was 1,000 people in line to get into this clinic. And I literally thought, how am I seeing this on the screen of my mind? I'm awake, but I'm actually watching this at the same time. This is going to change the face of true health care. Yeah. Yeah. What he's delivering is health care. Mm-hmm. And what we've been dealing with for years on end is sick care. So I went outside to call my husband, and I said, you're not going to believe this. I had the craziest experience. And I told him, he goes, you're not going to believe this. The guy you were high-fiving in the meditation just called and wanted you to join him in creating a clinic in Palm Springs, California. And that was Dr. Toby. So 7 weeks later, it happened. We started our first clinic, and it was multi-disciplinary clinic for people under the poverty level. So it was subsidized by the government. And what he wanted to do was offer patients a way to transform through education and treatment. So a multidimensional program that helps them, it educates them, because they're not good at, that population just, what they would do was go to the emergency room as their primary care doctor. So it was very expensive for the insurance company, and it wasn't really honoring the patient very much. So he wanted to put in twofold, serve the insurance company and also serve the patient. So I said, absolutely. I saw it in a vision. I would love to join you in this mission. So we had chiropractic, acupuncture, yoga, Tai Chi, Feldenkrais, Pilates. We had massage, behavioral health, medical, and I brought in meditation. Mm-hmm. So we had all these modalities to serve the patients. And so we started off with one clinic, and we went to several clinics right away. And it was super successful. The insurance company gave us one check per year, and we actually saved them money, and we also helped our patients get better. So we gave them the education, and they could make better decisions and empower the patient with their health. So it was super successful. We went really quick. Dr. Toby kept asking me, what are you doing with the patients? We have patients that are healing from all different types of conditions, and all they're doing is learning that meditation, Dr. Joe Dispenza's work, when they do it, they're actually taking their power back, right? They're actually acknowledging that they are participating in their healthcare.
Because I love the concept. I think the way you develop the clinic with Dr. Toby, I mean, it's exactly how it should be. Because, when you bring different healthcare providers together, they can collaborate more.
And I can tell you the reason why it was so successful is we weren't given a 15-minute parameter per patient. Right? They were scheduled out, but when a patient met with me, I met with them knee to knee, eye to eye. I never turned my back on the patient. I asked them what's going on with them. I looked like, and I did, I cared about them. When they first came into the clinic, we did a patient orientation. We told them what they were going to do, how we were going to help them. We wanted to pull them off as many meds as possible, and we wanted to supplement them with nutrition and with natural remedies. So we also had naturopathic doctors there. So we were giving them all the tools to transform their body into a healthy body rather than a chronically sick body. So you can imagine these people were under the poverty level, so they were chemically stressed, physically stressed, and emotionally stressed, and really at their wits' end, I can tell you that. So we gave them, the inspiration at the beginning of our program that we're gonna serve you, we're gonna take care of you, we're gonna follow all these different protocols to see where you fit in. Is it more mental? Is it more physical? Is it where are you the most stressed? And we're gonna address that. and then add other things to it.
And sometimes when you relate to the person into a real relationship of gratitude and you take the time as you did, you can really merge into the person's, insight and see what the most benefit for the person. And,
absolutely.
And it's like a sharing,
Yes.
There's a real relationship that is.
Absolutely. And they felt heard. They felt like someone actually cares about me, because our patient education was a good hour and a half. So we went over, why you're in stress, why your body's breaking down, why this is happening to you. I remember this one day, and I always hug my patients. I know it's not, typical for medical doctors, but I always hug my patients because I just do. And I remember one day, this one gentleman, as I was done adjusting him and he was leaving my treatment room, and I gave him a hug, and he said that was the first time someone's touched him in 9 years.
Wow.
And he cried over that. And touch is so important too.
Yeah. Yeah, I truly believe that. And I think that we should have, as healthcare provider, more often some contact, physical contact. It can be just a hand over the shoulders and just to exchange, and pace the energy. Wow, this is amazing what you have been developing. Do you have an example, like patient that were having difficult time into their mental health condition, and through your services, they really shift into
many
state of mind? Yeah,
many.
Can you share some example?
People that were brushed under the carpet and not cared for because they had been through the medical route so many times, and they go to their healthcare provider and nothing's working, nothing's taking care of their pain. Our clinic was focused on chronic pain. Right? So what they were doing was they were getting more meds. The meds would work for a certain period of time, and then they would need more. And then they would need more. So, yes, they were so grateful for the treatment. So people coming in emotionally, distraught. And they would come in, we would have patient orientation once a week. And we'd have a group of, 15, 20 people in our orientation. And they would come in, hands across their chest, looking down at the floor, because it was just like, same thing, different place. Same thing, different place. No hope, no inspiration, no potential for healing. I'm just being pushed through the system. But when we sat with them and we recognized them, we put name tags on them because we could call them out by name. So really let them know that we cared, because we really did care. And they felt that. And then they went from being like this to sitting up. We had lots of people crying because they saw these people care about me. I mean, we're connected. Humans are connected. And like you said, that one soft touch, or that one saying, I'm here with you. I know what you're looking for. I know what what you need.
The feeling of gratitude that you are recognized, and then they have the feeling they can recuperate their own power and their feelings of, I will.
Yeah,
I can.
Well, we did this. We would do a lot of education with our patients, and so we would do groups of education. So in the naturopathic part of our program, and I would do this with some of the naturopathic doctors, is we would sit in a circle and we would go over people that had type 2 diabetes. They don't know what to eat. No one's educated them. They have type 2 diabetes, their sugar's high, and they're just taught to keep their sugar at a certain level. Well, we would go around and we would do a demonstration with a cup, and then we would have each one of the patients put a teaspoon of sugar in that cup, 16 teaspoons, because that's what's in a soda.
I'm really, really amazed about all the realization you have done.
Yeah,
it's very.
And I was in clinic for 5 years, and we saw a lot of chronic conditions and people that were chemically stressed, physically stressed, emotionally stressed, so hardcore that I would have to walk out of clinic and go sit on a rock outside, deal with myself before I could walk back in, because these people were, in a lot of trouble. Yes. But I cared so much about them, and what a doctor misses a lot of the time. And I think what I really enjoyed about this population is I could see potential. And if a doctor can see potential in their patient, that they can do it, that they can get better, that's a big part of the battle. The doctor needs to see, okay, I see this patient getting better, right? But a lot of doctors just say, oh no, I got to give them what I have, and it's more drugs. There's not a bigger solution. So when you see potential in your patients, they sense that, they feel that, they want to live up to that potential, right? And things change. But when you reach a point you don't see the patient getting better, you're just in the rat race with them, you know?
And also because of the touch element, the contact, you know, the patient can feel, and they can also see the energy and say, oh, now I am at the right place. And they are taking the time, you know, like I always say, you know, why it became like the Formula One, you know, all the medical services seems to be fast. Oh, it's everywhere like that. But we are there to make the change. And I truly believe in that, as you do.
Yeah.
Then in the services, you said you include also meditation.
Yes.
Which also is probably a major element that you observe all.
Well, people don't know that they're living by anxiety every single day. When you're in pain, so this population was chronic pain, they are anxious. They are in so much pain that they're in fear constantly, that is this going to get worse? Am I going to get better? Their thoughts are around their condition in such a way that they can't get beyond that. But bringing Dr. Joe's meditations to clinic and sharing with them the potential of stopping that habitual thinking and feeling and opening up their awareness to some other possibility, getting out of the way, allowing their body to go into balance there for a little bit, and they get a little taste of that, they're like, wow, my back pain feels so much better all of a sudden. Or, oh my goodness, I had one patient that she had chronic rheumatoid arthritis. She had almost every joint removed and replaced. And she was sitting in a chair. We did a meditation, one of Dr. Joe's meditations. She came out of the meditation. She said, I have not felt this pain-free in all of my life. Nothing has made me feel this pain-free. Now, granted, the pain came back not too much longer, but she experienced that taste of, oh, I can do something about my condition. You know, the longer she would linger in that space of, I could heal this, then, oh my God, she realizes she can do something, which is what we want all of our patients to realize, that they have the potential to heal.
Yeah, yeah.
Based on how they apply these different techniques, you know?
Exactly. We know that meditation has a high efficiency for pain, anxiety, PTSD, depression, for that type of conditions. And this is something for me, I really wish that we can introduce in all type of treatment for these patients, just to start the practice and have the place, to really understand and feel, like you just mentioned, that they have their own power to do it.
Yes. It's so rare that people look under their own hood of who they are and know how they work. How backwards are we? We're thinking everything comes from the outside, fixes us on the inside, rather than looking, how do I operate from the inside and relate it to the outside, right? Our biggest mission as doctors and healthcare providers is to empower our patients to look under their own hood. How are you functioning? How are you behaving? What can you do to change your health, right? It's not in some little green or blue pill.
Then is it like 2 years that the Inner Science Foundation started? About 2 years ago?
Yeah, a little over 2 years ago we started in Marco Island. And the reason why we launched was because we first did our first research project in February 2019. And the only reason why we were able to do that was a beautiful woman that I met in Niagara Falls. And she asked, how are you guys funding all of this research? And I said, I don't know. I don't know. We're going to get grants. Somebody's going to help us. We'll get some grants. And she said, how much do you need? And I just threw out a number. I said, $100,000. And she said, you've got it. And we were like, what? Dr. Joe was like, huh?
Then this is all,
and so
how it starts, you know.
Yes,
and
this
you
is how it
became the
started.
director of
And so she donated the first 100,000, which brought us through our first research project. But after what Dr. Hamill found in the analysis of all of that data was shocking, and now he was all in because he's like, what?
Yeah.
How is this possible? Okay, there really is something going on here. So then we needed to get together and start a nonprofit. And so it took a while to open it up, and then we started just a little over 2 years ago.
Having all the retreats, and you have everybody wants to participate too. I mean, a lot of people, they want to be part of the studies, you know.
Yeah, they're so sweet. They definitely want to, because they know deep within themselves this is going to change the face of true health care.
Yeah.
What he's delivering is health care. And what we've been dealing with for years on end is sick care. You know, we're not teaching health care.
It's totally changing the way we...
It's a paradigm shift.
Exactly.
You know, and we've reached all the way to the edge of the mountain. You know, we're going to go over the edge at any minute unless we pull back and change directions. And I think we're at the forefront of that.
How do you see the next few years? Because I think you are into a race level now.
Yeah, I don't know what's going to happen, but I know something spectacular is coming out of all of this. I think we're showing up at the exact right time. I think this work is going to make a big splash, not only in healthcare, but the way research is done. Because we're not looking at matter to matter. We're looking at the energy aspect of it. And, you know, we're 99.999% energy, and how we utilize that energy is based on how we think, how we act, and how we feel. And if we take all that energy that we are and we're in a contracted state of being, we're moving closer to disease, right? But if we take that same energy and expand it out and be more selfless in the world, that lends to a better world, right? It's going to change a lot, hopefully.
To be the best version of yourself.
To be the best version of yourself.
And you share the idea, you know, it's like,
I'm really excited about what's going to happen. And, you know, the documentary comes out, like you said, in March. And the nice thing is we're making a big splash at UC San Diego, where they're doing all of the research. So how beautiful is it that we're having the chancellor of the university that's going to make the announcement that we're there. 2023, we did studies at 7 different events. We looked at 2,500 participants' information like blood, saliva, EEG, HRVs, microbiome surveys. So Dr. Joe collected all of that data with his team, Metamorphosis, and Metamorphosis handed it off to Inner Science, and we bring it to UC San Diego. So Inner Science funds all the analysis of all that data that goes to Dr.
In 2 years, it's amazing. Like
in 2 years.
It's like a very fast growth.
It's fast, you know, and all the right people are showing up at the right time. You know, the reason why we're so successful is because people come to his events, they heal from all different types of conditions like your friend, and all they want to do is say, oh my gosh, this has helped me so much in my life, let's help the next person. And that's the way the world should be. You know, that's why the donations are coming in.
Testimonies are showing, you know, like the real transformation that the person has been going through, you know. Oh my God.
It's just I mean, the whole thing is like a beautiful, moving timepiece as one, you know, it's all the right people or have some kind of connection in all of it together.
True. What will be your last words, you know, to tell?
Is don't be afraid to try something new and step into a new way of being as far as how you are with your patients. And we got into this profession because we wanted to help and heal people. Right? I mean, that's the bottom line. And what heals a person is a nice touch, the sound of your voice, paying attention to your patients, giving them the best knowledge that you have. And what we're finding is, you know, meditation is so profound and so needed as a foundational piece to people's lives. And so don't be afraid to change the paradigm into something that works even better than what's been what we've been using for such a long time.
Yeah.
Take the leap. It's worth it. It's definitely worth it.
That's great.
Yeah.
Thank you, Hillari.
You're welcome.
Yeah.